Hello and welcome to Helios Skin, Hair and Laser Clinic's YouTube channel. Choices are plenty today for everybody, and choosing is a big decision. Therefore, the myths are also growing. In today's episode, I have with me Dr. Shraddha, who's going to be busting the myths for us. Welcome, Dr. Shraddha.
Hello.
How are you?
I'm good.
Well, we're going to be talking about a lot of things today, and you're going to help me and the audience understand what is best for us. So let's begin with being Chennai and being a city where we are constantly exposed to sun. SPF is something that we see on the shelves today. So how do we choose what SPF is good for us?
True. So the thing with SPF, it actually means sun protecting factor. It means how much of UVB, the sunscreen can protect you against the UVB rays. So that's what it means. So you need to use a sunscreen of at least SPF 30. If you have any issues or any problems with pigmentation or any sun-induced problems, then you need to go up to SPF 50. Beyond that, it really doesn't make sense, because with SPF 50 you get about 97% protection from the UVB light. So you need to know that if you think you're using SPF 100 or 90, it doesn't mean anything great. SPF 50 is good enough.
Doc, they say that you need to use sunscreen only when you're under the sun. Is that true?
No, that's not true. You need to use a sunscreen every day, irrespective of whether it's raining, whether it's cloudy, or whether you're indoors, outdoors, it doesn't matter. You need to use a regular sunscreen. And when you choose the sunscreen, it's important that you choose even the UVA protection part, which is not just the SPF is UVB. UVA you'll have either 3 stars, minimum there should be a 3 stars, but the recent sunscreens have something what is called the critical wavelength. So the cutoff wavelength is 370 nanometers. So they have to look at that value and buy the sunscreen.
Doc, all of us love hoarding. We buy products and we keep them, and some become very attached to us and we don't want to throw it.
Correct.
Just like that, sunscreens we buy. How long do you think they have a shelf life, or how often do we have to change a tube?
Good. That's a good question, because what I find is people buy it and then they use it after a very long time. So when you use a sunscreen and you see the oil part coming out separately and then the cream part, that's when you know you shouldn't keep using. You shouldn't use that, discard it. Also look at the expiry date and make sure that you're using it within the expiry date.
Super. Ma'am, we spoke about sunscreen. I'll continue, in that line. So, off the kitchen shelf, we have a lot of remedies, and we see dime a dozen, on social media platforms. We've probably read about them also.
Yes.
There's one favorite one, the lime. The use of that particular, vegetable or fruit or whatever you like to call it is there for all remedies, including hair and face. So how effective is using lime?
See, lime, I would definitely advise against using these lime things off the kitchen in the first place, and lime specifically no, because what it does is it has a lot of citric acid and it can kind of damage the skin. It can alter the pH of your skin. So already we have a slightly acidic pH, so we shouldn't alter that pH. That's very important for the skin barrier function. And also what it does is it does lighten to some extent, but that's also not a effect. I would rather call it a side effect, and there's a lot of peeling. Some people come up with a lot of burns also. So then trying and repairing what damage they have done makes it more difficult for us. But I would suggest don't use it. If you need anything to sort your skin out, dermatologists are always there to help you out and to use the right products, the right ingredients, so that they get the desired effect, rather than use these things and cause problems for your skin.
Vitamin C.
Yeah. So I get a lot of patients nowadays, they say they see Insta and then they start using not just vitamin C. They start with like some 5 creams in the morning, 5 serums, and then 5 in the night. I don't know where they have the time to apply that, but I would suggest keep the routine simple. If you need a vitamin C, get to your dermatologist to give you the vitamin C, because not all vitamin Cs are good. One is the preparation. The stability of the vitamin C is very important. So you need to check if the ingredient is a stable vitamin C. If you, sometimes it gets oxidized and then you won't get the result of it, so there's no point using it. That's one thing. And second thing is, when you buy these things off the shelf, and we recommend, ours may be a slightly more expensive when you get it off the shelf. If you're using less quality products, or if it's cheaper, you better get it verified with your dermatologist if you're using the right kind of vitamin C on your face. And second thing is, if you have dry skin or if you have acne prone skin, I would suggest against using vitamin C, because it already is, your skin is dry, and this tends to dry the skin a little further, so avoid vitamin C then.
So much of information, doctor. Thank you for that. And today, because of Google and so much available online, everybody is becoming a self-made doctor, which I don't think is really advisable. So continuing in this train, doctor, is ingesting lime juice and all that also help with the skin?
So yeah, there are a lot of fat diets and take this juice, ABC juice. There's no scientific evidence to say that consuming juices per se improves your skin, but of course the fruits or the whole fruits containing the vitamins, the vitamin C, vitamin E, vitamin A, all those definitely help in the skin. Taking spinach orally definitely helps, rather than grinding it and taking it as a juice. So I would suggest a good, healthy, well balanced diet rather than these smoothies or these juices as such.
Doctor, coming back to what's available on the net, the latest trend is those rollers. You have those jade rollers.
Right.
Yeah. How effective are they, or should somebody really use them?
No, they're not effective. It's just a myth, or maybe a feel-good factor. To some extent, yes, it does improve the lymphatic drainage of the face, but in overall terms of skin quality or improving your skin texture or lifting your face or tightening, no, it doesn't do anything of that sort. It at the most improves the lymphatic drainage. That's about it.
So since you spoke about lymphatic drainage, I've also seen videos where people recommend that you tap your face, basically slap yourself at the lymphatic zones, or you have exercises that they show. Yeah. I mean, are they really recommended? Do they really help?
No, there's no scientific evidence to say that it helps. It really doesn't help as well. We do have better treatments and scientifically proven treatments which actually can lift your face or tighten the collagen layer and give you a good youthful look or a plumped up skin, rather than rubbing all these things on your face, and definitely no science behind it.
The word plump caught my attention. I recently saw a video where you use a lip balm and your lips get plumped.
So actually the lip balm doesn't do much. There are certain ingredients like hyaluronic acid or certain ingredients which can absorb the moisture from the air. So in that way it can kind of smoothen out the lips. That's the amount that it can do, but not really plump it up as such. No.
Doctor, you spoke about pH balance. Now, there's always this myth around the amount of the quantity of water one should take. So is it really necessary that somebody should keep hydrating themselves with 8 liters, or is it
2 liters is adequate per day? You don't need to take in more than that. You will only trouble your kidney. So, and you will cause a lot of electrolyte imbalance. So 2 liters is good enough. People can go up to 3 liters depending on whether they're working out excessively or they're losing a lot of in the sun, or losing a lot of sweat and that kind of a scenario. They can go up to 3, but I think 2 is good enough.
Again, doc, is there a preference between cold water and hot water, or?
So as consuming it?
Yes. Or maybe even external usage?
So coming to consuming for the skin, there is no scientific evidence to say that you should either of the waters do help. Of course, drinking a lot of water is good. Cold water, consuming it is not good for overall health, for the sinus, those who have prone for sinus, that kind of thing, but nothing related to skin as such. And coming to applying it, they do apply some ice. I've seen it on YouTube and stuff, that using ice. It kind of causes a vasoconstriction. Any cold can reduce. So that way, if you have any redness or any thing on the face, it can improve it can kind of soothe the skin. That's what it does, but it really doesn't address any long-term issues or any problems as such.
So, Doctor, I've been asking you a lot of questions now, but I'm sure you would have come across a lot of myths, in your experience. So, is there something that you want to debunk?
Yeah, more than myths, I would rather say that I come across on a daily basis patients who come to me and say, give me a list of products that they've seen on various influencers or whatever you call them, and they use like about 4 to 5 in the morning, 4 to 5 in the night, and it's not worth it. See, you have a cup, that much it can hold. You keep putting 4 to 5 creams or serums, it really doesn't make sense. What I would suggest people to do is get a proper simple skincare routine which they can sustain. Using expensive creams doesn't mean it's good. Using many products doesn't mean you're doing the right thing for your skin. So it's important that you use the optimal skincare for your kind of skin. Use the right products, because for somebody else something else may work, but for you it may not work. So minimize the thing. You don't need to use a serum, you don't need to use a gel and a moisturizer and niacinamide and like about 8 to 10 ingredients is in the morning. So you don't need all that. Keep it simple. Sunscreen, if you want to do one thing, just do the sunscreen, and if you want to do one thing in the night, use an active. Depends, if you are an acne prone person, get an anti-acne medication like an acetic acid or a glycolic acid from your dermatologist. If you do not have anything, if you're in your 30s, you could start with your retinol or peptides, a night cream, a good one which suits your skin. So that I would suggest, more than any myth or something regarding skincare, this would be ideal.
My next question was around the acids, Doctor. Acid.
Yes.
There are so many acids available now. Can you just enlighten us about that?
So, coming to what we say, they're basically fruit acids. They're derived from fruits, and we have something called as alpha hydroxy acids and beta hydroxy acids, which are scientifically proven, which help in skin rejuvenation, in skin lightening, in acne, in many things. So the common acids that we use on our skin is glycolic acid. That's more for anti-acne, for pigmentation. Then we have azelaic acid, which is also for pigmentation, anti-acne. It's a very good molecule which I like very much. You have retinoic acid. There are different forms of retinoic acid, whether you can use it for acne, you can use it for certain skin conditions, you can use it as an anti-aging molecule. So that is another acid. And you have kojic acid, which is more for skin lightening. Ascorbic acid is nothing but vitamin C, which you can again use it as a skin lightening agent, as an antioxidant. So yeah, this is the acids that I would suggest. There's also salicylic acid, which is more for active acne. People with active acne with a lot of redness, it does help. Now, what I would suggest is there are a lot of home remedies where they buy these spot peels or things. So anything that you're using on your skin, you have to be very careful. You have to value yourself to apply the right thing on your face or whatever you do to your face. So go to your dermatologist, see if you're already using, get it sorted by your dermatologist, because what I always tell is bring everything to me. I go through their contents and tell them, okay, this is okay to use, this is not okay. So at least that they can get it done. Rather than using these acids on their own.
Very interesting, Doctor, because there's so many, like I said in my introduction, the choices are so many today, and thanks to the power of advertisement, people really don't know what to pick.
True.
And like you rightly recommended, it's always good that they go to the expert, because I think there's no other better person than an expert telling you what you have to do. So we've been talking a lot about skincare. Now I'm going to be asking Doctor about hair, because that's another thing that most girls who said girls, even men are worried about their hair. So let me begin, Doctor, with oils. Again, so many oils, combination oils, infused oils, fragrant oils. Does applying oil in the first place help hair growth? Then we go to the choices.
Actually, it doesn't help.
It doesn't?
It does not help at all. Anything to do with hair growth. It, at the most, what it does is it can smoothen out the hair or the roughness, that it can reduce to some extent. So I tell my people, our scalp already has oil glands, so it has natural oils. You don't need to put an oil on your scalp at all. If you have very dry frizzy hair, maybe at the edges of the hair you can use it, but otherwise no, it's not.
That's interesting.
And especially if you have dandruff. People think having dandruff and it scales out, so you put oil, it helps. No, it doesn't. It worsens the dandruff, because dandruff comes because of excess oiliness. So avoid oils, especially if you have dandruff.
Very interesting. So what happens to the age-old regime of oiling, weekly oil bath and oil massages and all that?
So
does that really help?
That's what, it only helps the textural changes of the hair. I mean, it helps the texture of the hair, not really the hair fall or hair growth. No. You can, that's what, you tell people don't use, they don't like it. So if they really are someone who's used to applying oil, I say use it just half an hour before your hair wash. So that should be once a week. That's what I do.
So I was reading up and I came across this very interesting fact that horse's hair is rich in keratin. So we have a lot of keratin treatment. So does that mean that I get a ponytail?
Yeah. So keratin is a protein that's present in skin, your hair, your nails. There are different types of keratin. So therefore the thickness is different, and animals have a different type of keratin. We have different types of keratin. So keratin treatment is actually a misnomer. It doesn't really strengthen your hair or do anything. In fact, it smoothens out your hair. It breaks the natural bonds and smoothens out your hair. So it's not necessarily that it improves the hair. It gives you a smoothness, which is okay for those who have very entangled hair. It's fine to do it, but those who have thin hair, those who have hair fall issues, I would suggest don't use keratin.
So what does one do, doctor? Just this is out of our context. What does one do when they have excessive hair fall?
So the thing is, now when we say hair fall, we divide it into whether it's a recent onset or you have been having hair fall for a long time. And if there is a recent onset, we do something called as the hair pull test. You just touch your hair and put 20 strands and pull it out. If you get even one strand, we say it's positive hair pull, which means it's a condition called telogen effluvium. Now telogen effluvium typically starts 3 to 4 months after a trauma or an insult to the body. It could be a fever, it could be an infection, it could be a surgery, it could be pregnancy, delivery, it could be anything, or acute stress, even emotional stress. After that, 4-5 months later, the patient starts losing a lot of hair. So that's called acute telogen effluvium. We have to remove that, cause. Or if something it's already gone, we just have to wait for it. It will settle with time. We have some good treatments to reduce the hair fall. And then there's something called as chronic telogen effluvium, where either because of thyroid or anemia or something internal, which we have to evaluate. So they have to see a dermatologist, especially if they've been having hair fall for more than 3 months. You must see a dermatologist and get it evaluated and then treat it. So then we can treat. There's also a different kind of hair fall, which is balding, male pattern and female pattern. So that the earlier you treat, the better the results are.
Again, advisable to consult an expert.
Yes, it's easier when you come earlier. We can give you better results than you come in the later stages when you're bald or when there is no hair follicles. There's very little that we can do for them.
So doctor, again with hair, cleaning of hair, they say dermatologists recommend that you don't have to shower every day is one. 2 is if you stick to one shampoo will improve the hair growth. I mean, is this really true?
So the recent recommendations are you wash your hair every day. So it doesn't, and washing your hair every day does not cause hair fall or it does not damage your hair. Of course, if you have, it depends on the kind of shampoo that you use for your hair. Now shampoos don't cause hair fall or they don't improve the hair growth. They are good for specifically if you have any scalp issues like dandruff or any problem, then they definitely do help. Second thing they do is they improve the texture, so prevent the hair breakage. So that is what shampoos can do. And if your hair is dry, there are certain shampoos that you need to use. If it's oily, you can use certain things. Basically, there's something called a surfactant in the shampoos. So the anionic surfactants are like, that's what gives you the lather, the foam. And you have the cationic or amphoteric, which is seen in baby shampoos where it doesn't lather much, so that's very mild on the hair. So people who have dry hair, they can use those kind of shampoos, like baby shampoos. That's how they should choose their shampoos. If they can't, show it to their dermatologist, we'll help them out.
Doctor, very interesting thing, that people turn to is not just for drinking, but also using it on the hair, is beer. So how effective, or do you really recommend using beer to bring about shine and change in texture for the hair?
No, I don't recommend beer at all for the hair or any other way. But there's no scientific evidence either. But it does improve the shine, maybe the fermenting process or the trace elements present. We don't know what exactly, there is no research done on this, but yes, patients do tell me it does give them a good bounce and a good feel for the hair. I don't see any harm in using it occasionally, but I don't recommend, or there's no science behind it to say go ahead and do it either.
Similarly, rice water, doctor. There was a lot of videos at one point in time, using rice water will help hair grow. I remember, probably this is also another grandmother's remedy, where we used to use the starch, the rice water drained, for the hair. Is that also recommended?
So the thing is, we don't recommend it because we don't have enough evidence, but there is some reason to use all this, because it does coat, it helps the outer layer of the hair, it coats it, kind of as a conditioner, kind of what conditioners do, it does in maybe lesser effective way than what a conditioner does.
So since you mentioned conditioner, is it really essential that one uses a conditioner?
Yes, you need to use a conditioner at least once a week for those who have normal hair. Those who have very dry hair, even twice a week or every time after they wash their hair, they can use conditioner. There's something called as the 18 ME layer, which is the outer coating of the hair. And if that layer is not healthy, the hair looks very rough and it can break easily. So by using a conditioner, it kind of smoothens out the hair, and there is a protection for the hair shafts.
So doctor, you've been giving us a lot of valid and useful information about skin care and hair care. Like I said, today social media is such an influencing factor in everybody's life. I think it's like the one go-to solution for everything, not just skin and hair care. But like you said, turning to an expert is always the best thing. Recently I have seen something, doctor. They're recommending vapor rub as an alternative for moisturizer.
Definitely no. Vapor rub is actually, it can irritate the skin, cause further inflammation, it can disturb the barrier of the skin. So definitely don't do anything like that. There are a lot of things like this. I saw even toothpaste on the acne.
Yes.
I've seen patients come with burns and it's left permanent marks on their face. So please don't do anything like this. No vapor rubs, no baking soda, no lime, no Vicks, whatever, all these things. Please do not use it on your face.
Again, no, doctor, there's so much happening on the social media and so much of information. You have mentioned, saying that it is good that you consult a dermatologist. My question is, when does one actually come to a dermatologist? See, if we go to a general physician when you know that you're getting a fever or there's something symptomatic in your body. How do we and when do we come to a dermatologist?
So they should come, or they can come to a dermatologist even if they don't have a problem. If they want a normal skincare routine, or what are the ingredients to use on your skin. So anything they want to do with the skin or hair, they can come and see us. There is no timeline when they should come and see. But of course, if there is persisting problems in the skin, like if they have acne, which is not, they have tried over-the-counter OTC preparations, it's not working, please do see at the earliest, because once they get marks or scars, then it becomes difficult for us also to treat. So if they do have problems which is persisting beyond 2 to 3 months, they have to come to a dermatologist. But otherwise, if they have anything to do with the skin or hair, they can come and see us. We are always available. There are so many dermatologists, so many of us.
Thank you so much, Doctor. I hope the interaction today with Dr. Shraddha has opened your eyes to a lot of things that we thought, is good for us. Do keep watching our YouTube channel for more such information, and we will come back to you with a lot more information on skin, hair and laser care. Thank you so much, and this is your host Sunedra.